This segment illustrates some strategies for using practice experience as a teacher by sharing relevant stories, using stories and narrative to illustrate nuance and complexity in palliative service delivery, how common formative professional experiences influence how we interact with patients and families, the perspectives of patients and families, and purposefully linking stories back to module objectives.
A few years ago, I was working on a weekend on call, and I got a call from the hospital to see a young woman that had been sent in with cervix cancer. And they sent her in from a small town because they were really struggling to control her pain. And I got to the emergency room, and she was on the highest dose of opioids that I had seen. She was on 1,700 milligrams of morphine intravenously per hour. Yeah. And no, respiration was fine. No problem with respiration because this has been a gradual thing. I mean, it just demonstrates how the body adjusts to this. Okay. But what she did have was she was very confused. Okay. And she also had very severe myoclonus, twitching. Okay. And we'll come back to that. So she was having opioid toxicity. And the team in the small hospital had done everything that we had taught them. And we had taught them pain is what the patient says is pain. And so this patient was saying, I've got more pain, and they were doing exactly what we had taught them. And that's go up with the opioid, it's fine. And I'm not saying it's a bad thing. We do need to do this. We do need to do titration. But what they missed was that there was a delirium evolving.
I remember one nurse in tears when we were doing one of these talks on communicating and talking to patients, because her head nurse once had caught her crying with a young patient with leukemia who was dying. She said, you don't do that, you're a nurse. You know? And there's no harm saying, I'm sorry that I can't take this away from you. Because studies have shown that patients only want us to be there with them and to not abandon them. So I remember there was a patient, Emily, who had bowel cancer, and she went and she had surgery, and she didn't have a bag, and she thought this was the greatest thing, no bag. Didn't want to hear anything about the surgery. She was in her 70s. But of course it was bowel cancer and it was metastatic, and that's why it was an open and close, and she was staying with her sister looking after her. And her sister Anna was looking after her, and she was getting frailer and weaker and more cachectic, and she's saying, Anna, what's wrong with me? I don't know why I'm getting like this. And this poor woman in her head was this, she told me not to tell her, can't talk about it. So that was a terrible burden on the caregiver.